This medication is used to treat growth failure, growth hormone deficiency, short bowel syndrome, and HIV-related weight loss or wasting. It is also used to increase height in children with certain disorders such as Noonan syndrome, Turner syndrome, and idiopathic short stature. The daily dosage and the best time to take this medication will depend on the individual's condition and should be determined by a healthcare professional. Before using Norditropin Flexpro pen injector, it's important to read the patient information leaflet provided by your pharmacist. If you have any questions, consult your doctor or pharmacist. Some brands of this medication are given by injection into a muscle or under the skin, while other brands may only be injected under the skin. The way you inject this medicine will depend on the brand that you are using, so be sure to check with your pharmacist to ensure that you are doing it correctly. It's important to change the location of the injection site to avoid problem areas under the skin. The dosage is based on your age, weight, medical condition, and response to treatment. If you are giving this medication to yourself at home, learn all preparation and usage instructions from your healthcare professional. Do not shake the solution, as shaking can make the medication not work properly. Before using, check the product visually for particles or discoloration. If either is present, do not use the liquid. If you are using a pen device, do not share it with another person, even if the needle is changed, as this can cause serious infections. If this medicine is used for short bowel syndrome, consult your doctor if a special diet or the use of nutritional supplements may be helpful. If this medicine is used for weight loss/muscle wasting, it may take up to 2 weeks to notice the effects of the drug. Do not use more of this medication than prescribed or use it more often, as this can increase the risk of side effects. If you experience headache, nausea, vomiting, tiredness, muscle pain, or weakness, make sure to inform your doctor or pharmacist. It's important to remember that the benefits of using this medication outweigh the potential side effects for most people. However, be sure to tell your doctor right away if you experience any serious side effects such as unusual tiredness, change in vision, or severe headache. In rare cases, this medication can cause serious lung/breathing problems in children with Prader-Willi syndrome, especially in males, severely overweight children, or those with existing lung/breathing issues. If your child experiences heavy snoring, irregular breathing during sleep, or signs of lung infection, it's crucial to contact the doctor immediately. It's also important to discuss the potential risks and benefits of this medication with your doctor, as it may increase the risk of getting a tumor or cancer. While a serious allergic reaction to this drug is rare, it's essential to seek medical help right away if you experience symptoms such as severe swelling, dizziness, or trouble breathing. And as always, if you notice any other effects not mentioned here, don't hesitate to contact your doctor or pharmacist. Before using Norditropin Flexpro pen injector, it's important to discuss any allergies you may have with your doctor or pharmacist. This medication may contain inactive ingredients that could cause allergic reactions. It's also important to share your medical history, especially if you have adrenal gland problems, eye problems, recent major surgery or injury, breathing problems, diabetes, kidney disease, cancer, thyroid problems, or back problems. If you have diabetes, this medication may increase your blood sugar, so it's important to monitor your blood sugar regularly and discuss any changes with your doctor. When this medication is given to newborns, it should be mixed with sterile water for injection that does not contain a preservative, to avoid any potential serious problems. Before having surgery, make sure to inform your doctor or dentist about all the products you are using. It's important to note that older adults may be more sensitive to the side effects of this drug, especially effects on blood sugar or swelling. During pregnancy, Norditropin Flexpro pen injector should only be used when clearly needed, and its effects on breast milk are still unknown. Be sure to consult your doctor before breastfeeding. It's important to be aware of potential drug interactions that could affect how your medications work or increase your risk for serious side effects. Always keep a list of all the products you use, including prescription and non-prescription drugs, as well as herbal products, and share this with your doctor and pharmacist. It's crucial not to start, stop, or change the dosage of any medicines without your doctor's approval. When using Norditropin Flexpro pen injector, it's important to note that it is very similar to lonapexamitropin. Therefore, it's advised not to use medications containing lonapexamitropin while using Norditropin Flexpro pen injector. Be sure to discuss any concerns or questions about potential drug interactions with your healthcare provider. And always follow their guidance for the best results. If someone has taken too much Norditropin Flexpro and is experiencing serious symptoms like passing out or difficulty breathing, it's important to seek immediate medical help. In the US, you can call your local poison control center at 1-800-222-1222, and in Canada, you can call a provincial poison control center. Symptoms of overdose may include severe headache, severe nausea or vomiting, signs of low blood sugar such as sudden sweating, shaking, and confusion, as well as ongoing swelling of the hands and feet. It's crucial to seek help right away if you or someone you know may have overdosed on Norditropin Flexpro. It's important not to share this medication with others. Your doctor may also conduct lab and/or medical tests while you are using Norditropin Flexpro pen injector, such as eye exams, thyroid function tests, glucose level tests, and growth hormone antibody level tests. Be sure to keep all of your medical and lab appointments, and consult your doctor for more details. Make sure to take each dose of Norditropin Flexpro pen injector as prescribed. If you happen to miss a dose, consult with your doctor or pharmacist immediately for a new dosing schedule. It's important not to take a double dose to make up for the missed one. Make sure to consult the product instructions and your pharmacist for the proper way to store Norditropin Flexpro pen injector. Always keep medications out of reach of children and pets. It's important not to flush medications down the toilet or pour them into a drain unless instructed to do so. When this product is expired or no longer needed, be sure to properly discard it. You can consult your pharmacist or local waste disposal company for guidance on the best way to do so. If you need more help, call your doctor for medical advice. In the US, you call FDA 1-800-FDA-1088. In Canada, you may call Health Canada 1-866-234-2345. Wishing you good health. Thanks for watching.